Good morning, Debbie.
Good morning.
We just took finished the braces a week ago, and we just delivered the retainer today. This is a video at the completion of treatment like we normally do. We briefly viewed the video when we started a few years back. So how are you doing?
I'm doing well.
Okay. Speak up since I'm all the way over here.
I'm doing well.
Good deal. There are some concerns we had, obviously, to start with. Briefly tell me, if you would, how did it come about Dr. Reevely, your dentist from Lamar, sent you over to us?
I switched dentists. I switched to Dr. Reevely. I was on my way to Texas to a doctor there to take care of where my jaws had gone to, and he suggested I come see you before I make that trip.
Okay. So who referred you to Texas for what?
The dentist I saw previously to Dr. Reevely had given me the name.
To go see doctor for what? What kind of a doctor? Surgeon?
A surgeon.
Okay. For jaw surgery? Mm-hmm. Okay. So I'm guessing you probably had some contact with that surgeon's office by phone or something, email?
I had called him, had the appointment set, and was set to go. Okay.
Well, when you say set to go, you mean, how do you mean? What was supposed to get done when you went to Texas?
That was 4 years ago. The beginning of the process, whatever they needed to do.
In preparation to, they're set to do surgery for you?
That's the direction it was going.
Got it. All right. So that was because they felt like your joint can only be fixed with the surgery, because we do hear that all the time. It's not unusual. So, so tell me briefly what you went through over the last few years.
Here?
We did a lot of scans and so on, a lot of measurements and testing. I know it's been a while. Measured your muscles, and remember the next step after that?
Orthodontics.
Okay. No, we did orthotic first, removed orthotic
yes.
to see if it helps you at all, and then went on to orthodontics. That took a while. We had a few things to get done.
Yes.
Now that it's all done, finally, tell me about how your symptoms are, how you're doing in general.
Well, when you put the orthotic in, the headaches immediately were gone, and I have not dealt with headaches.
It's been 4 years.
Basically any for 4 years.
I see.
They've been very rare, and usually they're sinus related if I have one. So that has been, I'm very grateful for that.
Good deal.
And
thank you.
the popping, just within the last month, that has stopped when I open my mouth. I can open my mouth. For me, it's full range. It's more than I've been able to open it for the past 30 years. And
wow.
So that
can you demonstrate to me? What do you mean by open your mouth fully? Okay, that's a full range of motion.
Where before I could open it maybe the width of one finger. And so anyway, that's been good. Yeah,
not that you had to put finger, but I would say you have 4 finger width. That'll be a normal range of motion, 3 to 4.
Yeah, I think I can get 30 in, but that's huge for me, so I'm thankful for that.
Okay. And what other things? You've also had headaches. You mentioned that it's gone away. You had neck pain as well?
Yes, I had neck pain. I think I'm still going to have some issues to deal with muscles. I don't think I'm there yet, but I am grateful for all the relief I have just from the popping and the headaches.
You've been traveling, at least 2-hour drive or longer?
2 hours.
About 2-hour drive each way. I know some people go longer, but it's still quite a commitment. Come all the way here to get all this done. Now that you've gone through this and got it finished, if you were to, knowing what you know now, if you were to go back to square one, would you do things any differently?
No, it was to the point, if I just opened my mouth to speak, there was grinding and popping and...
In your joints?
In the
joints? Both joints?
On both joints on my jaws, and I had to do something, and I'm very, very thankful I came here.
Well, thank you.
I would do it again.
Well, especially, you spent a lot of money also. Let's be, frank about that. It's a lot of money and time, a lot of travel. So with that perspective, you still would do the same thing?
Absolutely. And I wish there were more options of something closer to home where it was more common that you could get this kind of treatment, and that people could get to you and to know about this. Because 30 years ago, I was having the same problems, and they shaved the back of my teeth was the first thing they did. And I could tell you lots of things that have been tried, but...
What are the other things tried?
Early 80s was when I first started having the problems. And
this is 2014 June. Okay.
And they shaved the back of both my teeth, and that didn't do much.
And that was supposed to help you? Okay.
I don't know what they were thinking, that it would make my jaw slide forward.
They call it equilibration.
Okay.
They call it equilibration. Actually, again, part of the reason we do this video is my passion to educate people about it out there, about this possibility, and thank you for doing this. The equilibration is, the idea is to grind teeth or adjust teeth so that the joint will seat into what they call centric relation. Not coming forward, it's actually going up and back. So that is the theory behind it. Many still do it.
Opposite of what we did.
Absolutely opposite of it. And still done.
Didn't help.
Still done.
Well, and then the next, I married and moved to Lamar and changed dentists there, and again the headaches and the popping was still there, and so that dentist, he had his own thoughts on what could help too, and good man, just he put a appliance on my teeth that completely covered my teeth, front and back, and again it ended up pushing my jaw back, and that did not last long. It was more pain.
Sounds like the theory was still trying to go backwards, which is opposite of what we did. Again, you know, as you mentioned, good man trying to do what he thought was the best for you.
And since I went the wrong direction quickly with more headaches and more pain, another dentist in town quickly said that he could help, and I think he got closer. He came up with an appliance that just covered my lower teeth on the sides, which just created a little space for my jaws, and it did not push back. It literally just created space, and that helped for a while.
Could you function with that? Is it something only wore at nighttime?
I only wore it at night.
Okay.
But it was sure better than anything I'd had to that point.
Understand.
Creating space.
And how did that compare to the orthotic we did for you, the neuromuscular orthotic? Because you had to wear this 24/7.
Yes. The one that you created, it was for all my teeth, and so it supported the front teeth as well.
It changed the way how the jaw lines up truly 24/7.
Yes. Yes.
What other attempts were done besides the one you last talked about, the back teeth only?
He put brackets on, which I had on for a year, and I don't know that they did anything.
You mean orthodontic braces? I see. Okay.
And they were just on for 1 year, and I don't think there was any change.
Okay.
So
and that's when he's the doctor that said, all right, I've done everything I can, you go to surgeon? I see. All right, I think we're back to square one, then we Dr. Reevely, and then back to here. Anything else to add to somebody that might be watching this? Because a lot of times people hear this. I hear it quite regularly. Sometimes grown-ups, sometimes little kids, 17, 15. I've heard it as young as 15 told nothing can be done. You have to have surgery. So what would you tell such a person?
From what I learned with the surgeon, there's just like a 20% success rate, and what you're doing here after 30 years of dealing with this, I couldn't be more pleased to not have headaches and to be able to open my mouth with no popping. I'm still dealing stuff with my posture, but that's a whole, I'm 50, and that's a life.
You look a lot younger than 50.
That's a lot of years to try to change patterns of my posture. But that, I think, plays into the neck and some of that. So
the approach we use is, go ahead please.
This is the route.
The approach we use is called physiologic, neuromuscular dentistry. I know, mouthful. This is looking at the whole physiology, neuromuscular, nerves, muscles, which is the first step we started with you. And it's not just first time, of course. We've seen you time to time and recheck everything to make sure things are good. I'm so pleased that I'm able to help somebody so nice as you. Thank you so much.
I'm thankful. Thank you.
Tell me, what is your number one concern?
Number one concern is the popping in my jaws and
Point to me which ones, right? Both of them?
both.
Okay.
They pop on both sides. They're loud enough. If you're standing next to me, you could probably hear them.
Okay.
If that goes on for a while, if I add any pressure or stress, then pain is associated with it, and then
Okay, show me where the pain would be.
the pain would start here.
Okay.
And
So that is the number 1 or 2?
that's all number one. It just
Okay.
depends on the extent on how far it goes.
Okay.
And
What's number 2?
the number two would be when I go to headaches.
Okay, point again where the headache would be.
And it's been 5 weeks since I've had one, so
When you do, I'm sure you remember.
actually I try to forget. But I know there's,
Okay,
there's
turn slightly so I can see where the hands are. Okay.
here and it's back here.
Okay.
And it can, when it gets to that point, every muscle on my face is hurting. And those can last 2 to 3 days.
Okay. That is number 2.
And that's number 2.
Okay. And you're going to say something before I interrupted you. Last 2 or 3 days.
They last 2 or 3 days.
Okay.
Usually I can get it gone by then.
Okay. And how do you make it go away by then, 2 or 3 days? Are there some strategies or just goes away on its own?
I take Tylenol
Mhm.
and I focus on drinking lots of water. My diet goes strictly to protein, vegetables.
So you do less chewing? Is that what you're saying?
I back off of
Okay.
anything I can.
So that's what you do to make it go away. All right. What's number 3 problem?
Again, if it's all tied together, just every day, if someone could rub and massage the muscles in my neck and up in here, that's a constant.
But when I palpated those areas, you didn't say anything about anything hurting.
It
Or-
does not hurt. There's just a lot of pressure.
Okay.
That if someone could just press and just relieve that pressure,
Okay.
I don't know how to describe it.
Okay, but it's
any
not a
more than
pain.
that. It's not pain.
All right.
It's just
And what is
pressure.
the next one? Is there one other one?
That would be it.
All right.
Clicking, the headaches, and pressure.
Okay. Thank you.